Okay, I've got about 10 minutes before I have to run. I want to go over some patient before and afters, Botox and fillers, talk about treatments they've done. I want to show you that yes, Botox and filler can look natural. I'm Janelle, I'm a cosmetic nurse practitioner. I've been injecting Botox and fillers for the past 11 years. I have 2 clinics in Los Angeles. One is in Mar Vista, one is in Torrance. My team and I really specialize in facial aesthetics. We treat all skin types and tones. We treat a lot of women of color. So I pulled some before and afters. I don't know how to switch green screen on TikTok Live. So I put them all on one page and we can talk them through. So in this top corner, this is a patient that came to me. I think she's in her late 20s, early 30s. She'd never done anything. We treated multiple areas of her face. All these patients that we will discuss today have done multiple areas of their face, Botox and fillers. And I just want to show you that, yes, it can look natural. Also, I made these into a swipe feature where you can read exactly what they did on my most recent post. So you can look at them there. But in this top picture, this patient came to me and she was just like, I want a little refresh. I want to look a little more glam. We did filler to her under eyes, her nose, her lips, her chin, her lower face shadows, her cheeks. And some of these words might be covered up. But what we notice is the under eye hollowness is not so increased. It's not as hollow there, and light reflects off the face a little bit brighter. Her nose, it's hard to see in these. So again, go swipe and see them on my main page. But her nose has a bump. She wanted her nose to be straightened out and to have a little bit more of an upturn. We did that. Her lips, she has naturally full lips, but she wanted some more size and to notice it from the side profile. So you can see her lip. Oh, my kids are already knocking on the door. You can see her upper lip looks a little bit fuller there. And then into her chin, she felt like her chin set back a little bit relative to her upper face features. And so we did filler into her chin to elongate the jawline, balance that profile. So where her chin does not sit back so much. We call it recessed, or just where it sits back. Okay, this patient in the top is a younger patient. She's in her early 20s. She had never done anything. She felt like she looked tired. We did filler to her under eyes, and it kind of extends into her mid face as well. So you can see this happens as we get older. We lose volume from our eyes, and it'll extend into the cheek. So we did some there. She has a little bit of redness after being poked up. She also wanted to increase the size of her lips. She liked her lip shape, so we did that. And then we did some into her chin as well to bring some highlight and balance to the lower. So again, if you want to see the full picture, if you go onto my main page, you can see the full thing. So expect bruising, expect swelling with this procedure. I tell everybody, give yourself a few weeks before major events because you can bruise and swell. We send you prep on what to do beforehand, like avoiding blood thinners, avoiding alcohol, taking arnica, eating pineapple to help minimize bruising and swelling. And then this bruising, swelling, it'll get more swollen, then it comes down after a few days. 2 to 3 weeks is the worst of it. 6 to 8 weeks to completely settle. Okay, over here we have Sujia. I know a lot of you guys see her. She's on TikTok. All my patients find me from TikTok, so I love TikTok. We have been working together for 2 or 3 years. We have treated her whole face. So she came in, we had started with Botox in the upper face. She wanted to do some lip filler. We did lip filler a few times. Finally, I was like, Sujia, I can't keep doing your lips. Your lips are starting to overpower the lower face. So if you can just trust me on some stuff. She allowed me, and we did some into the lower face, lower shadows, so into the corners, and then some into her chin. And so you can see that we're camouflaging the shadows, we're camouflaging jowls that happen as we get older. Our fat pads, remember, they start separating, they start sinking, they create these jowls where our jawline doesn't look as straight. So I did a little bit into her chin, and I went to camouflage the jowls. We've also done some into her cheeks, and we have Botox everywhere. So we've been doing stuff. She's made videos about this over the past 2-3 years of the treatments that we have done. So you can check them out there. And then we film a bunch of stuff in in clinic, and then I just never post it because it takes me a long time. But you can see she looks like herself. She looks fresh. She does her lipstick tutorials and her makeup reviews. Like, it always looks like her. That is always the goal. Okay, here's a patient I've treated for a long time as well. Beautiful, just naturally. Everyone's beautiful without Botox fillers. We're using these things to just help bring out your natural features, soften shadows, create some light reflect off the face. So she felt like she looked tired under the eyes. Remember, we lose volume here over time, and that will extend down into the cheeks. So we did some filler under her eyes. We did some into her lips. She wanted fuller lips, and into her chin. So you can see where her chin is a little bit more set back in the before versus the after. It's more brought forward, elongated. When we do chin filler, this helps to support like the lips. I know a lot of people think like lip filler, lip filler, lip filler. I'm like, at a certain point, if you keep doing lip filler, your lips will dominate the face where it looks like you've done lip filler or it looks done. We don't want that. That's where like things look a little weird to people when you're just walking by the street. They're like, oh, it looks like she's got her lips done. So just be mindful of this lower face where you don't want the lips dominating. Do some into the chin, do some into the corners of the mouth so that everything is seamless. Yeah, you can tell. Looks super natural, glammed up version of herself. If you see this girl walking on the street, you're not going to think, oh, she's done a bunch of Botox and filler. Okay, this is a patient. I did a Beauty for All campaign the past couple months, and I was just doing this to continue to highlight diversity in aesthetics. My team and I treat a lot of women of color, men of color in our clinic. I don't think there's enough inclusivity in this industry, and I'm always trying to show that yes, women and men of color get cosmetic treatments. They can be done where they look very natural, they look like themselves. Everyone deserves to be feeling seen and safe and beautiful in this space. So this patient came to me. She had lost over 100 pounds. You can tell she's beautiful, but she's just like, I feel like my face is saggy, is droopy, especially after weight loss. This is very common. As people lose weight, we lose fat in our faces as well. So these same areas I was talking to you guys about where we lose fat pads, they start separating, they start sinking as we get older. It is almost expedited if we lose weight because we're going to lose fat here too. So for her, we did some filler into her under eyes, and there's different views of her on my pages. I have a bunch of videos of her like sharing her story, which is just really cool. And she even talks about like the healing process of it all. So she did filler under her eyes. We did some into her cheeks, again, where this is splitting and the cheeks aren't as lifted. We did some to soften the smile lines. Oh, I did that for Sujia too. Soften the smile lines. I let patients know when we are doing smile lines, my goal is not to get them all the way gone. If we get you to have no smile line, it can look a little weird. It can look like you've done something. So we want to put some support underneath, but we don't want the lines to be all the way gone. That's the goal. It's not going to look like a filter where there's no lines on your face because we are still going to be talking and smiling and moving. So anyway, we did some under eyes, cheeks, smile lines, corners of the mouth, into these shadows. Look, when we lose volume over time, or think about people as they get older, they have like deep lines and the corners of their mouth are kind of downturned. You can see, can you see there? Downturned corners of the mouth. So we put some there. We did some more into her lips. She wanted her upper lip a little bit fuller, and she just wanted to hydrate the lips as well. And then we did some into her chin. Again, trying to elongate the jawline, helping to support and balance these features. A lot of Black women, we have like fuller cheeks, fuller nose, fuller lips. Our chins can be a little shorter. So putting some filler here brings some highlight to that lower face. And you can see just looks super natural, beautiful, glammed up version of herself. She says she just feels way more confident, especially after the weight loss. She's just like, I feel like I look like myself before I lost weight. And then this patient, it's kind of cut off here, but she came in, we did under eyes and we did her lower face into her chin. So if you look close, you can see where the chin is kind of set back. It is a little like, it irregular, like not a smooth transition on the chin, but it's mostly set back. She also has naturally fuller cheeks, fuller lips. So we put some filler into her chin. It gets cut off right there. But you can see it elongates the jawline, brings it forward. A lot of times people, if they're like concerned with their side profile, they think they want jawline filler. I didn't do any filler back here on this patient, but into the chin, I did it, and her jawline, both, it looks improved on both. So this is just some of the patients. I have hundreds of patients before and afters on my pages, on my website, on all the things, and patient reviews and patients sharing their stories and talking and like letting us film and taking us through the journey as they heal and what that's all about. I'm always trying to just showcase that, yes, again, Botox filler, these treatments can be done safely and beautifully where they look natural, and it can be done for women of color, in everybody. But that's what I'm always trying to show. So my patients, I shout out you. Thank you for sharing, to just continue to spread this message, spread awareness that yes, it can look fresh and natural, beautiful. These are just some of the patients that I've seen. I've been doing this for 11 years. I love it. My goal, again, is to really hear you out, hear where you are, what your goals are, help you look and feel like your most refreshed self. Let me know if you have questions. I haven't been looking through questions because I was on live earlier and I did not know how to go through before and after. So I put some of them together. I can put more of them together and do this more frequently and just continue to highlight these patients. So many of our patients share, and it takes me a long time to like edit videos and put them together. But again, I'm just trying to show it looks like them, like whether they're bruised, they go through the healing, all of it. It's just really cool. And if you have more questions about this, let me know. My whole style, my team style, is really assessing the full face when we are just spot treating. So if somebody just comes in and they only want lips or they only want smile lines, again, it's okay. You might not understand like the aging process, like what's going on beneath the skin, but that's what I'm thinking about. How do we age? How can I make this look the most natural and not like you've done filler? Even if you want to be like a glammed up version, even if you're like, no, I kind of want my lips to pop, like we can totally do that, but we don't need it only to be your lips to pop or only your lips that are like the focus of your face, because it looks unnatural. So that is where I will talk to patients about their face, their features, their cultural ideals of beauty, their whatever their goals are, what their job is, what do they need to do for work. Some people, I'm in acting, I need to frown, or I'm a therapist, I need to frown and show emotion. We can totally work through all those things, but making sure we have this conversation at each appointment. And I've been with some of these people for my whole career, 11 years. Every single time they come in, we sit down, we talk about where they are in life, what's upcoming, are they getting ready for an event? Oh, have they lost weight? Are they going, what life stage are they in? And we talk about, how can we use these treatments to help them look and feel their most refreshed self. We talk about the full face. We talk about aging. We don't just get these smile lines. It's not like the lines just get deeper. A lot of people come in, they're like, overnight, this just happened. I never had this before. It's not overnight. It happens over time. And it's not just this line. So we are losing volume in our faces. We are losing bone, fat in our faces over time. It starts from like up here. We will get more sunken into our temples where things look more concave, sunken there. So when we use filler into our temples, it'll help bring highlight. It makes your cheek look like it's all the way extended back. It helps the brow to be supported. So we start from up here and then we assess what's going down. We have different fat pads on our face. As we get older, they start separating, they start sinking. So we will get this line from here through there. Look in the mirror. You might see a little shadow of it already. If not a deeper line, it happens. This is all the faces. It's not just one person. Like this is what happens as we age. So they separate, they sink, and then they create this deeper line along our smile line, and they create this line at the corner of our mouth. This will keep sinking, and creating a jowl. Our chins will start to lose volume and lose bone here, so this gets a little bit more irregular and pushed back. Our smile lines get deeper. We lose bone right here next to the nose. Our nose will look wider. So I'm thinking about all of these areas of the face and how we can use fillers or collagen stimulators or all natural filler alternatives to help restore some of that volume and just minimize some of this aging. Okay, let me see. Dana said, facts, my temples are sunken in. Thank you. And people don't usually notice it. People don't realize, like, yeah, we lose volume. I don't know what this is. We lose volume starting from up top. We lose volume into our temples and it will look sunken. Think about like the cone heads where it's like sunken like that. It happens over time. And people will think, even me, sometimes I'll try to just like wear my hair to like cover it, but we start to see a shadow here, or like, yeah, the brow is not as supported, or it just, again, you don't have like, it doesn't look like your cheek is all the way brought through. So that is something we want to keep in mind there. And then let's see. I got filler 5 months ago and it's randomly sore today. Is that normal? I don't know about it being randomly, like you shouldn't be having random soreness in your areas you got filler. Think if you had any trauma, if you slept on it, I would think maybe those could add to maybe why you're sore. But usually you're sore for like 2 to 3 weeks after your injections. You can still feel it a little bit, but at 6 to 8 weeks, you won't be feeling it. It'll be settled into your skin, but it's just 2 to 3 weeks of like maybe that swelling and bruising. How to reduce nasolabial folds. So nasolabial folds are our smile lines. We can assess the face. A lot of times we might be putting a little bit of filler into the mid face and here, because remember, we're losing volume all through up here, but through here and here, it'll help the cheek look lifted. It'll help these lines not look as shadowed, as deep set when there is highlight along that mid face. So I tell patients, usually we're assessing here, soften this up, make that highlight look pulled back. It's not actually pulling you back like surgery, but it makes that highlight where it looks pulled back. And then we can soften the lines. We are not trying to chase to have no line at all right here. If we chase to have no line at all, it's going to look fake. It's going to look done, unnatural. So I tell patients we're trying to put some support underneath, like right here at the base of the nose, like on the sides. This is where we will usually the deepest part of the smile line. So putting some there will make the lines look not as deep. And then I'll soften the lines, not try to get them all the way away. Yes. Can filler help with flat noses? Yes, it can. Oh, I didn't even I have one girl up here that had nose filler. I have a ton of before and afters of noses and of Black and brown women with nose filler that I have done. Filler along the nose is going to help camouflage a bump. If you have a bump, it's going to help lift the tip of the nose. It's going to create definition and contour along the nose. For somebody that has, and I have these photos, there's patient before and afters on my TikTok, my main page there. You can see it, or on our website, or on my Instagram profile, like on everyone. But if you put filler here, it creates this highlight and it looks contoured. The patients always tell me, oh, it looks like I did my makeup. It looks like I contoured my nose. So I just go straight down the middle. From the front, it's still gonna look like your nose, but there will be a little bit more definition here. It's not gonna be a surgery where it's actually gonna like take your nose in and pinch it, but it does bring that highlight and contour down the center. Patients really like it. It still looks like them. A lot of women of color tell me, I like my features, I like my nose. I'm not trying to have a super pinched in nose, but I want some more definition. So yes, it works really well with that. I do that. I do almost all of these things in a couple sessions. I tell people, do your stuff, like do your filler, let it settle 6 to 8 weeks, and then we can always add more if we want. Let me see if I can find other questions. Okay. Let's see. My temples are sunken. You did my filler a month ago. Oh, thank you. Oh, somebody said I did their filler a little bit ago. Aw, thanks. She said, trust me with her face, and I'm amazing. Thank you. I really appreciate that, and I appreciate you sharing. Because again, like I said earlier, I'm always trying to show faces, like my patients and just regular people who want to look and feel their most refreshed self and look and feel like themselves. natural and not overdone. So that is my goal. Oh, hey, Bree. I hope you're doing awesome. Thoughts on lower face tox in DAO injections. So somebody was asking about filler into the lower face. Like you can put some here at the corners of your mouth. It prevents the corners of your mouth from pulling downwards. I'm not a scared injector. I've been injecting a long time. This is probably my least favorite place to put Botox just because it is a small muscle and it lines up right next to another muscle that connects with the way we smile. So if you are not exactly on that smile, you can cause somebody's smile to be asymmetric. I've never done it that I know of, but I have seen patients that have had it happen to them and they come back to me like to me to ask how they can fix it. You kind of have to let it wear down. We can use some drops into the gum line to help soften it. But every time I do it on patients, they love it. It's just not my favorite spot to do. I will put filler in or collagen stimulators into these shadows where we lose volume over time. Okay, let's see. Botox in their nose a month ago. Didn't notice a subtle change. I want to go back for a touch-up. Botox for the nose will help prevent the nose from like curling downward, prevent the nose from the nostrils from flaring. I can't do it. And like kind of lift the tip, but it's subtle. For almost all the pictures I have of nose before and after are done with filler. So Botox, I don't expect a ton of difference with. Filler, I'm going to see that more dramatic result, and I do it over 2 sessions. Thank you so much. Someone said my videos are informative. I'm always trying to educate and just show this stuff can look natural and what I want you guys to look out for. If you're not seeing me, because I'm going to talk a lot in your appointment and I'm going to talk a lot on here, but if you're not seeing me, I want you to be informed before whoever you're going to see so you know what to ask for and what to look out for. How much is dissolving under eye fillers cost? It costs $250 a vial. It depends on how much filler is there. It can take multiple sessions, multiple vials. And then I am 36, so thank you. I've done a lot of stuff to my face. I have 3 kids and 2, they're little and they're drive me crazy, but I do a lot of stuff to my face. Okay, I saw somebody else say something about, I can't find it. Someone was saying something about filler migration. I just cannot find the thing. Okay, filler migration gets a lot of hype on social media where you will see these videos and people are like, my filler migrated. Oh my gosh. It's like, it was in my lip, but now it's up here. I want to talk about that. I don't think filler is just slipping and sliding around people's faces. A lot of these videos that you guys are seeing about this like filler migration, when I look at the patient, I'm like, dude, it's not slipping and sliding. It didn't just move out of your lip. It shouldn't have been there in the first place. If you are trying to force something that won't fit, if there's no more space in the lip, the filler, when the injector is trying to put it, is going to go where there's space. So we have to realize as injectors, as patients, there are limitations with these cosmetic procedures. This is a gel. Some patients want to keep going and going. And I'm like, if we keep adding, it's not going to be what we want just because we keep putting it in there. We're going to start to lose your shape, or there's not space in your lip in the pink part. So it's going to be up here. We don't want that. So it's important when you're getting these treatments to just, again, realize the limitations. More does not always mean better. And like, if your provider tells you hold off, like, listen to them. That's important. Or sometimes providers won't say that because whatever reason, they want to just keep going. You need to look. And if it looks a little distorted, if it doesn't look right, talk to your provider about it. The cool thing is you can dissolve these. Most importantly, though, I think just trying to prevent it from looking overfilled or migrated, but really it's just overdoing it by not rushing it. All my patients know I won't re-inject the same area of the face until 6 to 8 weeks later. I see a lot of injectors talk about like, come in 2 weeks and we can add more after your swelling is done. It is not settled at 2 weeks. I know it's not. It takes 6 to 8 weeks for this stuff to settle down. Read my patient reviews. Like, they are very happy. Now, they know I'm like, I'd rather you be annoyed with me because I'm going too slow as opposed to going too fast, and then we're having to dissolve this. So wait the 6 to 8 weeks. At 2 to 3 weeks is where my team will like check on our patients. How are you? They'll tell us, oh yeah, the swelling has come down, but I still, I can feel little bumps. That's normal. I expect it. I'm like, don't mess with it. It'll be, if it's there, I'll dissolve it when I see you. They tell me they always come back at 6 to 8 weeks. They're like, oh my gosh, that bump went down. It did what you said. So I've just been doing this a long time. It takes 6 to 8 weeks for product to settle. Like, don't add more to an area before then. I have had patients come to me, oh, I went X, Y, and Z place, and I went several times, and they did my lips over, every 2 weeks. I'm like, dude, like, you're just stacking product on top of product. You are not allowing its time to settle. That's why it's migrated. It's not migrated. It's overdone. It shouldn't have been happened in the first place. Let me see. Oh, Morgan, thank you. Okay, let me see. My eye was overfilled. Does it go away, or do I need to dissolve? If it's overfilled, dissolve it. It takes a long time to go away, especially under the eyes. Dissolve it. Take that away. And then let me see. Do I ever put filler in for deep 11 lines? I think you're talking about right here into the frown lines. I will say Botox this as much as possible, just so that you don't like make that face. Botox here will prevent so there's a couple muscle groups we're working on. There's one right here and then right above the brow. These muscles, there's one in the middle, it pulls down, and then there's ones above the brow that pull in. When we Botox it, Botox will relax the muscle from pulling in and from pulling down. So then you can't make that face so mad. If somebody has really deep lines that are etched on the skin, even if they're not frowning and they're just there, like I've seen some lines that are just like this, and I'm like, oh, like even they're smiling at me and it's like that, Botox is not going to make that go away. It will prevent it from getting worse. It'll soften it some, but Botox is not going to make it like this when they're deep set. When you're not moving, if it's already really, really set, it's not going to go all the way away. You can get it smooth if you're consistent with it, but not 100%. Sometimes, occasionally, I will put filler into these if they're really deep. Just telling the patients I don't expect it to be 100% smooth. And also, oh, my kids are trying to get me. There's limitations to this. So we want safety with filler. We want to make sure we're not blocking blood flow off. We've got blood vessels all over our face, all over our body. I don't want to put too much filler in any spot so blood can't flow like normal. The blood vessels here run behind the eye. So if we block off blood flow here, there's potential for blindness. I say this stuff so patients understand the risk with Botox fillers, with filler. This is not Botoxing. This is super rare. I've been injecting for 11 years. This is all I do is faces. I've never had to dissolve anybody for any emergent reason ever. Any part of their face, any filler. So extremely rare. But still, we want to be mindful of these rare risks. We want to look for them. So we're looking for your skin color to be normal. You shouldn't have any extreme pain. You shouldn't have any vision issues. If you had anything like that, we dissolve the filler. I've never had to do that for anybody. We keep a ton of vials of the dissolver on hand in case of this rare emergency. Also for my patients that fly in, we've got patients that fly in every single day I'm in clinic. People are coming from all over the country and outside of the country. I tell them, stay in town for a day. If there's some rare thing, rare emergency, I want to be able to see you and take care of it and dissolve it. So they stay in town. I've never had to do it for anybody. We just want to be extra safe and realize that these are not just procedures like just get your nails and get a haircut. Like they're medical procedures. They need to be done by a medical provider. We want to be mindful of these rare risks and how to intervene. Do I have Botox and fill? Oh my gosh. I have done my whole face. And my first viral video when I did TikTok, I think it was like in 2020, was about all the things I did to my face. And it was like a 2-minute video talking about I've done this and this and this. I have not done anything in a little while, not any filler and Botox just because I'm breastfeeding. But before that, like before I got pregnant, this past one, probably a year and a half ago, I did like 10 syringes over, and you guys can scroll back through my videos, like it still looks like me. I've done filler into my temples, into my under eyes, into my cheeks, right here. Oh, my phone is going to die. Into right here where we lose volume, into the corners of my mouth, a lot into my chin. My chin was like pretty set back. I have Botox my whole face. I've done 200 units of Botox in my charger's downstairs. In my face, I've done 100 units just in my frown lines. I did that before my second pregnancy. It was during shutdown. And I was like, if I look crazy, well, we're on shutdown. It was 2020. And that lasted me over a year. So it lasted a really long time. My face, it still was able to move, but Yes, I have done so many things. Anything we offer in my office, I have done. I've done all the laser treatments. I've done microneedling. I've done collagen stimulators. I have done the all-natural filler alternative. I do that since I'm breastfeeding. So it's just something to give me a little collagen stimulation. Yeah, probably the only thing I haven't done to my face is my nose and my lips. My nose, only because it looks like my kids. They have like this fuller nose. I'm Filipino and black. And my lips, I already feel like they have like good balance with my cheeks and my chin. And I don't want my lips to like overpower my lower face because they were already doing that beforehand. So that's why I've done a lot of chin filler. But my lips do get kind of dry. So sometimes I'm like, maybe I'm just 36 now. So I'm like, maybe I should just like get them a little hydrated. Love me, girl. You're already gorgeous without any of this stuff, but I will see you anytime if you want. Do I do filler in the mid cheek next to the nose? So into here, it depends on the person, but most of the times, remember, we have these fat pads here, and I'm gonna just talk to my phone dies or until my kids knock on this door again. We have these fat pads. They separate a lot of times. So remember, they separate and they sink. So we get this line, and this will already be pretty heavy on people. So I'm not trying to like add to this heaviness because no, it's already full. I'm trying to like bridge this line, like these fat pads. You see how it dipped down? Watch. And it dips. I'm trying to bridge that, and I'm trying to make this highlight pulled back. So those are the spaces that I do on a lot of my patients, and it looks pulled. I mean, that girl, that girl, that girl, that girl, like all these patients, I will do it because I'm thinking about what's happening beneath the skin. So I'm trying to, again, create that natural highlight where it looks pulled back on their cheek, and we're distracting from this line that happens as we age. Yeah, better to go high up. Yeah, like we don't want to, and I see it, you know, I see it in LA where people like make this really full right here, and this is like really, it looks weird, dude. It looks bad. Like we all know it, we all see it. It looks pillow face. Like, no, I don't want when you smile it to be like puffy like that. No, I would tell people I'd rather you have a little bit of a line where it still looks natural and not overdone. Okay. Medial cheek filler helps with nasolabial folds. Yes. Okay, that's another thing. A lot of people will come in, I want these lines gone. And I'm like, okay. And usually I will talk to them and they're like, oh, I get what you're saying about like losing volume. Oh yeah, I see this line here. I see where my cheeks are flat. They will do this. I remember one time I had this lady came to me, I think from Houston. I always hate Houston and New York. But she was like, those things don't bother me, what you're talking about. She's like, just do the lines. I was like, all right. We did the lines. She was like, okay, the lines are like really soft now. She's like, well, why does my face still look sad? Like, why do I look droopy? I was like, ma'am, this is what we discussed. Remember, like we're losing volume from up here. And she was like, oh, you did say that. Like this is the same day, same hour. So she's like, okay, so we put a little in through here, like I had discussed. And then she was like, oh my gosh, my face looks lifted. I was like, I know. I know. I'm thinking about our whole face. I'm not just thinking about the lines, you guys. I'm thinking about what is causing this line. How do we get this line? How can I treat other areas to make this shadow not look as shadowed? So we did it through her mid-face. She's like, my face looks lifted. She's like, I look like my old self. I was like, I know. A lot of black women, a lot of women of color, we naturally have full cheeks. And so people are afraid of getting cheek filler because they think it's going to look like that weird thing that we see walking around. That's not it. I'm like, no. I'm being strategic about this. I'm placing it here. I'm placing it here into like these spots, and I'm using the right filler. I'm thinking about the right filler. You got to use the right product because that's the other thing. They'll say, I went somewhere, they tried to put some in my cheeks. I don't see a difference. I'm like, I know. What product were they using? We go through the products. I'm like, that's too soft. That's not going to lift a woman that already has naturally full face. Most women of color, we have thicker skin, fuller faces. I need like a thicker product to create that lift. So when we do it, it's going to look like, look at Sujia, look at this one. Sorry, this girl. And she's swollen here. It's not going to stay as swollen as that. That's dramatic. Even though a lot of people like it like that, I'm like, it's not going to stay as lifted as that. But it's going to look not pudgy. That's my goal. So I'm really thinking through all these steps and I'm trying to explain it to the patients so they get it. But it's not just this line. It is, yes, what is causing it? Are we losing volume here? Where do I need to replace it? Understand, when you get this stuff, it will look more dramatic in the beginning. Some people really like the dramatic, more pulled back, more lifted, more highlight. I'm like, if you like it, cool. Let me see you in 6 to 8 weeks and we can, I gotta get off this. Don't fall in love with this. Don't hate it. It's going to get more swollen and then it's going to come down. Do it in stages. So, and then, oh my gosh, you guys, I'm going to try to like read through these. Hopefully I can save, can it help with sweating over your lip? Yes, you can do Botox to help with sweating. You know, underarms, upper lip, nose. I've done it into the groin. I've done it in feet, hands. Is under eye filler okay? Yes, I love under eye filler in the right patient. You want to make sure you don't retain a lot of water underneath the eyes. If you swell a lot when you wake up, if you cry a lot, you eat salty food, you have bad allergies, you drink and you get swollen under your eyes, don't get filler because filler binds water. Natural fillers are the ones where we draw your blood, we spin it down, we heat it up. It's only created with your blood. There are growth factors in our blood and they're like supercharged when we spin it and we heat it. We re-inject it into areas of the face and it's going to help stimulate collagen over time. So I like those. I do those because I'm breastfeeding right now and I can't do anything else. It's going to give you an instant lift and then after a few days it'll look like you didn't do anything. Gradually, you're getting new collagen in the areas. So it's a slower process, but it is all natural for people that are like, I don't want to do filler. Like, I just don't for whatever reason, or they're not candidates for it. So yes, it is nice. Is it possible to address under cheek hollows with filler? So maybe you're meaning like through here. Sometimes patients with a thinner face might have like more dominant like cheeks and they're kind of like sunken above and below and their cheeks like that. So if you're a little sunken through here, I would do more of the collagen stimulators. Sculptra is nice, dilute radius. Filler, you want to be careful so it doesn't look pudgy through here. So that's something. I'm trying to hit the question. Oh my gosh, I do men. And my men let me film and they let us use their before and afters. Men, we do a lot of chins and jaw lines and under eyes. That's what in Botox. They come to me for that the most. So the chins, I'll make it a little bit more squared off if they want. A lot of times they do. It looks a little bit more like masculine, a little more rugged. We can square off their jaw lines. I have men on my page. I have men who film and like let us, they're on my this page and all my social pages and our website. And it looks super natural. And yeah, they feel way more confident. They love it. And someone else said they're Filipino black too. What do I recommend for smile lines? I want the tip of my nose pointy. This patient wanted the tip of her nose a little bit more pointy. We did that with filler. You can do that. Somebody said they thought I was 20 to 22. That makes me feel so good because I feel run down, running behind my kids all day, locking my door so I've been wanting to talk through before and afters. Okay, what else? Isn't she a TikToker? Second row. Yeah, that's Sujia. And I do a lot of TikTokers. Not all of them let me show their stuff. And, you know, they just, some don't, some will. Sujia's always like down for the cause and shows it. And yeah, my goal is to make sure, I don't care if you're a TikToker, if you're a teacher, I don't care what you are. If you're OnlyFanser, if you're a nun, I still want it to look like you. I want you to feel fresh and beautiful. I'm going to think about your life and what's going on. Are you losing weight? Are you getting ready for a wedding? Have you gained weight? Are you going through a divorce? All the things tell me that takes part and plays a role in your treatment plan. And your treatment plan is so individualized to you and what's going on. So we will have a discussion every single time you are in clinic. My patients that I have been treating for 10 years, every single time we sit down, we talk about where they are. Should we change something? What's going on? It's not just we do the same thing because our face changes. You got different stuff going on in your life. All these things I'm taking into consideration as we do your treatment plan. You bring your twin sister in, it could be a completely different treatment plan. So it's us having that conversation and developing it. Okay, these kids are knocking on my door. Okay, I'm gonna talk to you guys soon. Write me the other questions on the page and then I will do some more lives so we can keep going. I appreciate you spending some time with me and it's always fun coming on TikTok. All right, have a good night. Bye.